Hello, my name is Rachel Haswinkle, and today I will be discussing two different case files from the Unit 2 bank, Case File 4 and Case File 3. So Case File 4 was about the little baby, and Case 3 was about the little boy that was 5 years old. So for the first case I'm going to talk about was about the previously healthy 2-month-old female who has jittery spells several hours after breastfeeding. And then her mother reported that she had not given the baby anything other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours in between feedings, and that's when the mother kind of reported these symptoms and said they kind of started. So the hospital decided to take some lab cultures and do some tests, and the laboratory results showed that there was a consistency with hypoglycemia, but otherwise unremarkable, so no other red flags besides that. And she was given epinephrine, and that was administered, and there was no increase in blood glucose, but there was an increase in blood lactate, so that kind of was another red flag for the doctors. And in this case, we were supposed to kind of eliminate diagnoses and then diagnose her and tell you what she had. So I believe the baby had the glycogen storage disease. That was basically meaning that the baby cannot use glycogen correctly. When a person has glycogen storage disease, their liver cannot control the use of glycogen and glucose. So this causes an abnormal amount of glycogen to be in the liver. This in turn causes the low blood pressure because there's not enough glucose in the blood. So again, that was a symptom that she had, the low blood pressure. And some of these other symptoms for glycogen storage disease include low blood sugar, enlarged liver and kidney, enlarged liver because that's where all the glycogen is, and high levels of lactate, which again, she showed the high levels of lactate when the epinephrine was administered. These babies, these are all symptoms that the baby was showing. And then some other delayed symptoms of glycogen storage disease include delayed growth, bone thinning, and increased mouth ulcers. So it's good that they caught this early on so they can help the little baby as much as they can. To eliminate the other possible diagnoses, what I did is I kind of researched them and found their symptoms and was able to eliminate them to correctly diagnose this little baby with the glycogen storage disease. But for example, some of these symptoms of the galactosemia include loss of appetite and vomiting. Common symptoms for the hereditary fructose intolerance included chronic fatigue, gas, abdominal pain, nausea, and vomiting, which the little baby did not have those either. And lastly, the common symptoms for the glucose 6-phosphate dehydrogenase deficiency included fatigue, having dark, like tea-colored urine, and yellowed skin in the eyes, and having pain in the abdomen. For all of these three diseases, the symptoms were not the same as what the baby was suffering from. Therefore, all of these diseases could be eliminated from the diagnosis, and that's why, again, I kind of believe that the baby had the glycogen storage disease. The second case I will be talking about deals with the 5-year-old boy who was brought to his pediatrician for an annual checkup. When the doctor was kind of asking her questions, the mother reported that he is often drowsy and was sick quite frequently as a baby. And she also mentions to the doctor that her son is constantly thirsty and urinates quite frequently, so that should have been a red flag for the doctor right there. She also mentions just the sickness of her child when he was little. So maybe with that, he could have gotten something that attacked his pancreas or something. Blood samples were taken for the insulin measurements at the time 0 and 1 hour after the glucose loading test. And then from the results shown in the table that was presented to us, it shows that the blood sample is 0.8, which is super low. It should be around 6. And the table also shows that his insulin level was about a 5, and that's very low considering with a glucose challenge test like they ran, it should be at about a 40. So big difference there. So with his symptoms of increased thirst and urination, along with the low levels on the serum insulin, I think the diagnosis would be type 1 diabetes. Low levels of insulin are bad, and this is why it's kind of a dangerous thing and very severe to have, are bad. As the insulin circulates through your body, it allows sugar to enter your cells, which is what you want. And then that insulin lowers the amount of sugar in your bloodstream, so it just kind of keeps it at a normal pace. However, if your body's not producing insulin correctly, it can't do that. So with type 1 diabetes, the glucose in the blood is not getting used. So this leads to increased thirst and water intake, which then leads to increased urination. So that's kind of the red flag for type 1 diabetes. Type 1 diabetes is a chronic condition that happens when the pancreas produces little to no insulin. So when the mother said that the baby was sick quite frequently as when they were little, that also could have been a red flag. Different factors that contribute to the onset of this type of diabetes include genetics and some viruses. Some viruses that have attacked the pancreas can lead to type 1 diabetes. So that could have been another red flag for the doctor as well. And then if the boys' fasted blood glucose levels were taken, I think they would be high. This is because the cells cannot get as much blood to the glucose or blood glucose as they need, because again, that insulin is just not there to do that. This means that the glucose is in the blood not being used. Since there's no insulin to let the glucose into the cells, sugar builds up in the bloodstream. So I think that fasted blood glucose level would be pretty high. And then though glucose is not being used correctly, and I still think the glucogenic enzymes should be functioning correctly in a patient like this boy who has type 1 diabetes. Two of those enzymes for the that would be running that would be glucose 6 phosphatase and phosphofructokinase. And I think just because the pancreas isn't producing the insulin doesn't mean your other types and parts of your body aren't able to produce the glucose. So I think that's why those enzymes would still be working correctly.